Hello and good morning, everyone. I'm Abe Brown. I'm the Senior Advisor for External Engagement in the Office of Partnerships in the Office of Regulatory Affairs for the U.S. Food and Drug Administration. Today, we are celebrating the signing of a memorandum of understanding between FDA's Office of Regulatory Affairs, FDA's Center for Food Safety and Applied Nutrition, and the Center for Disease Control's National Center for Environmental Health. This agreement marks a significant step and a significant leap in this relationship. This will be signed today, September 21st, 2022, and this MOU formalizes each partner's commitment to reducing foodborne illness at the retail level. The long-standing relationship we've had between FDA and CDC includes years of effort and years of collaboration, and this document today will signify and formalize that collaboration with the ultimate goal of reducing foodborne illness and moving to the next phase as we document our progress and our continued growth. At the end, we will achieve what we've been wanting to achieve for quite some time, which is a vision of a national integrated food safety system. We have 3 signatories here. Our partners are represented by Dr. Judy McMeekin, who is the Associate Commissioner of Regulatory Affairs at the FDA. We have Dr. Susan Mayne, who is the Director of FDA's Center for Food Safety and Applied Nutrition. And we have Dr. Patrick Breysse, who is the Director of CDC's National Center for Environmental Health. Judy, take it away.
Good morning. I am really pleased to join Dr. Mayne and Dr. Breysse in signing this Memorandum of Understanding between the Centers for Disease Control and Prevention and the Food and Drug Administration, focusing specifically on reducing foodborne illness at the retail level. FDA's new era of Smarter Food Safety Blueprint calls for modernizing the U.S. retail food protection system, including identifying new partnerships and strategies to help ensure the safety of food sold at retail and food service establishments. FDA plays an integral role in increasing uniformity, consistency, and capacity of our state, local, tribal, and territorial retail food regulatory programs. We also promote industry's active managerial control of foodborne illness risk factors and a culture of food safety, as well as providing training to maintain a competent, skilled regulatory workforce. FDA's efforts on the new era of Smarter Food Safety Blueprint, combined with CDC's expertise in conducting foodborne illness investigations and leveraging research to understand the causative factors of foodborne illness, provides increased support to partners and industry. I'm confident we'll meet our goal of reducing foodborne illness at the retail level by leveraging our capabilities and maintaining a forward-thinking perspective. I want to thank CDC for their continued partnership, and we look forward to continuing to collaborate with CDC as we advance our shared mission to protect public health. Susan?
Good morning. I'm thrilled to be here today with Dr. McMeekin and Dr. Breysse, taking another step together to help strengthen the safety of food sold at retail. The FDA and CDC have been working together to enhance our retail food protection system for many years, and this MOU reinforces the long-standing partnership between our agencies and facilitates continued efforts in this area. The signing of today's MOU will help us move forward several fronts. First, our joint work in this space will help increase the consistency and capacity of retail food protection programs across the country. Second, it will further promote a general culture of food safety. And third, it will facilitate continued communication between the FDA and CDC, helping us better assist our state, local, tribal, territorial, and industry partners. This MOU is another step in our continued work to support food safety at the retail level. For the past 30 years, the FDA has helped support state, local, territorial, and tribal partners through the Food Code. The Food Code, which will celebrate its 30th anniversary next year, is a model for safeguarding public health and ensuring food is unadulterated for consumers. It provides uniform standards to better ensure compliance. It establishes a standardized approach for inspections, and it helps protect consumers and industry from potentially devastating health consequences and financial losses. Our collaboration with CDC has helped inform our work on the Food Code. Our CDC counterparts have been instrumental in identifying foodborne illness risk factors responsible for foodborne illness outbreaks. These efforts help us measure the occurrence of practices and behaviors that contribute to foodborne illness outbreaks at retail food establishments. Through our ongoing partnership with CDC and with the signing of today's MOU, we will continue to leverage the collective strengths of both of our agencies to drive down foodborne illness in retail and food service establishments across the country. I'm excited to be here today to officially recognize this partnership. Over to Dr. Breysse.
Thank you. CDC's National Center for Environmental Health is pleased to participate in the signing ceremony with the Food and Drug Administration. Despite improvements over time, foodborne illness risk factors remain responsible for many foodborne illnesses. Each year, more than 48 million Americans get sick and over 3,000 die from foodborne-related illnesses. Protecting food safety in the retail setting is an important component of any food safety system. About a third of all meals are eaten outside the home, and more than 2/3 of foodborne illness outbreaks that occur each year are associated with food produced in retail settings or other food service establishments. The United States spends approximately $78 billion per year on health care, workplace, and other related costs associated with foodborne illnesses. We know we can only achieve our vision to reduce or eliminate foodborne illness risk factors by working together through strong partnerships and collaborations with our federal, state, local, and territorial partners, including many organizations that work with and for them. This memorandum of understanding represents our joint vision and ongoing partnership to protect from threats to public health, including foodborne illness. We are pleased to contribute and support FDA's ongoing efforts to promote science-based food safety principles in retail and food service settings to minimize the incidence of foodborne illnesses, and we applaud FDA's leadership in this space. FDA's leadership and guidance have resulted in nearly 90% of the U.S. population living in a jurisdiction that has adopted some version of the FDA Food Code and its science-based food safety principles. We know these food safety principles are effective for protecting public health, and we'll continue to work collaboratively with FDA to encourage the adoption of the latest version of the FDA Food Code. CDC will continue to support state and local environmental health programs in the identification and prevention of foodborne contributing factors. We will continue to work with our EHSnet partners to conduct valuable research to better understand the contributing factors and environmental antecedents to foodborne illnesses and outbreaks at the retail level. We'll also continue to collect and translate high-quality surveillance data on contributing factors and environmental antecedents to foodborne outbreaks through the National Environmental Assessment Reporting System, known as NEARS. Together, these programs have allowed CDC to recommend food safety prevention practices, policies, and training using systems-based approach, as well as strengthen collaboration among epidemiology, laboratory, and environmental health programs among local, state, and federal partners. The work CDC and FDA do is synergistic, and we are excited to expand our collaborative work with FDA to improve guidance, education, and implementation of food safety best practices through this MOU. By leveraging our strengths, CDC and ATSDR, in partnership with all of you, our epidemiology, laboratory, and environmental health program partners, we will be more successful in reducing the occurrence of foodborne illnesses and risk factors in the retail food service environments. Thank you.
Thank you very much. And now for the signing. Judy, if you may begin. Now, Dr. Breysse. Now, Dr. Mayne. Thank you. And Judy, if you can show our viewers. Thank you. And congratulations.
Thank you.